Letter E. The line between the P wave and the QRS is called what? Take it as if you want. Google it if you want. It's fine.
PR segment?
PR segment. PR segment. Okay, what about the before the P to the QRS? What's that called?
PR interval.
PR interval. So from here to here, this is the PR interval. Cool. What the PR interval needs to be between how many, the answer's up there too, how many boxes or seconds, point seconds?
20?
No more than 20, right? So no more than 20. We want this to be no more than 0.020 seconds. Okay. So as long as it's between 0.12 to 0.20 seconds, we're good to go. That's normal. All right. And we really care more about whenever it's wider. Whenever this is wider than 0.20 seconds, we might have an issue. Okay. And then what did I say this one right here was? QRS, cool. Alright, QRS. So, right there with the P wave, what does the P wave represent?
The P wave represents.
It represents two things. You can tell me one of them if you want. And then I'm gonna ask somebody else for the other one. Just give me one of them if you can find one of them. When you guys look it up, I'm gonna ask you. Okay. SA not firing off.
Pre-wave means conduction.
Conduction's good. I'll give you that. So it's good because that means that the SA node is firing off, and we want every single heartbeat to come from the SA node, right? So if it's firing off, we have a P wave, we have a good start. Okay? Freddie, what does the PR segment tell you? What does that tell you? What's going on in the heart, in the conduction system? We have a PR segment. What does that represent? Anybody else can look it up while he's looking it up too, or tell me.
Wait, what was the question?
The PR segment, this right here between the P wave and the QRS. What does that mean? That it's an isometric line, that flat line. What does that mean? It represents something.
The electricity is passing at the AV node.
It's pausing.
Pausing.
Well, it's passing through there, so the SA node is firing off this way, and it's gonna hold that electricity temporarily to allow the atriums to squeeze while the ventricles stay relaxed. That way the ventricles can receive that blood. Remember that? Okay. And then, Sarah E, what does this mean, the QRS? What is that telling us? So P wave is SA node firing off, means atriums contracted. PR segment is that electricity pausing at the AV node between the atriums and the ventricles, which allow the ventricles to relax and receive that blood while the atriums are squeezing. So then now what is this QRS stand for? What does it mean? What's going on in the heart now physically? With the conduction system or mechanically? Or if somebody else can tell me, go ahead once she's looking it up. If you already know.
Electricity left the AV.
And left the AV node, right? So that's electricity has just finished pausing at the AV node, and now it's leaving. So now it's traveling through the ventricles. That's what that means, okay? So if electricity is passing through the ventricles, what are the ventricles gonna do? What does electricity make muscle do? Contract. So now they're squeezing. Cool. So this is squeezing. Who can recall? I didn't talk about this a lot, but let's see if so. Do you know what this means? That the line, the ST segment from here, from the end of the QRS to the beginning of this big old hump right there. What does that kind of represent? How I explained it. Oh, who can tell me? Look it up. If you guys don't, if she can't remember, somebody else tell me real quick.
The ST segment.
It's called the ST segment, but what does it mean though? Like what's going on in the heart? So we know that the QRS is the physical squeezing of the ventricles because electricity is currently going through there, so it's squeezing.
It releases electricity?
What?
Releases electricity?
It's the beginning. So I'll take that. So here is the electricity traveling through the ventricles, and this line represents that just squeeze, it's holding, that it's getting every last little drop. And then, what is this called? Who can tell me what this is called? The big old hump.
T wave.
T wave. So the T wave is the relaxing of the ventricles. So again, the QRS is the physical electricity going through the ventricles. So it's physically contracting, squeezing, right? And then this line, ST segment, is like that squeeze is getting every last little drop out. And the T wave is the relaxing. Okay? Hey, Maury, is it recording? Let me see it's recording.
Yeah.
Okay, cool. Alright. Let me see. Okay, so let's reiterate. So what we care about right now, we're gonna talk about heart blocks. Heart blocks. So with heart blocks, our main focus is between the beginning of the P wave and the beginning of the QRS. That's the focus for heart blocks, okay? And we care about the width. We care about it being wider than it's supposed to be for heart blocks. If that's the focus, okay? Just to keep it simple for right now. So we don't want it to be wider than how many seconds? One more time, somebody tell me?
20.
0.20 seconds. 0.20 seconds. Okay? So if it's wider than this, 0.24, 0.22, if you want to measure it like that, it's too wide, okay? And it's leading to a problem, okay? It's leading to a problem. So how many, and the answer is going to be on these two boards. We have big boxes on the EKG strip, right? It's made of big boxes, and within those big boxes, there's little boxes.
Mm-hmm.
How many little boxes is inside a big box? Just going across. How many just going across?
5.
5. Okay, so Freddie, now you. Those boxes going across represent time. It's just time passing by as the heartbeat goes through, right? That's all that means. Each little box represents how many seconds or how many point seconds. 0.04. I take that's good. 0.04. No, that's good. All right. So then, if we have 5 boxes going across a big box, each little box is 0.04. How much is each big box? 0.20, right? Perfect. So we're gonna use those to measure. So it's up there. We're gonna use these boxes to measure the width and to see if we have a heart block or not. So those boxes mean a lot, and that's why I taught you guys the measurements, right? Okay, so a first degree heart block, I put HB heart block, just means that the PR interval from here to here is longer than what? Or longer than what? How much time?
Could you read?
20 seconds, right? So all a first degree heart block is, if you ever hear a first degree heart block, it just means that from the beginning of the P wave to the beginning of the QRS, it's longer. So it's longer, more than 0.20 seconds. And this actually is not even a big deal. It could be the patient is taking a certain drug, and I won't get into those drugs right now. It could be, it could be now the patient is going to be having some other issue down the road, right? But this generally a first degree heart block by itself, the doctor's not really concerned too much. They're gonna keep an eye on it to see if it gets worse or if it turns into one of these, but by itself, it's not a big deal, okay? Any questions about this one? Okay, so one more time. I I have a first degree heart block, Freddie, what does that mean to you? What does that mean? Sorry. We talked about it. What does that mean?
It's more than 2.20 seconds.
0.20 seconds, that's it. So if I have a first degree heart block, all that means is that my PR interval is longer, is more, I put an arrow up, meaning more, it's wider than 0.20 seconds. And if it's wider than 0.20 seconds, it means it's wider than how many small boxes, Freddie?
6.
I'll take 6. It's 6. It's 6 at least, but it's wider than 5 boxes. That means that this interval is wider. Make a little box here. 1, 2, 3, 4, 5. It's wider than one big old box. So if it's wider than one big box, which equals 5 small boxes, I have a heart block. I have a first degree heart block. Okay? So if this PR interval from the beginning of the P to the beginning of the QRS, if it's wider than 5 little boxes, which equal one big box, I have a first degree heart block. Right? Freddie, I have a first degree heart block. What does that mean to you now?
It's smaller than 0.20.
Awesome. So if I have a first degree heart block, instead of saying 0.20 seconds, what else can you say? It's wider than than what?
Then 0.12.
No, wider than think in boxes.
Oh, wider than 5.
Than 5 boxes. So hey, what's a different way of saying that? So it's wider. It's if I have a first degree heart block, that means that the PR interval is wider than 0.20 seconds. Also means that it's wider than 5 little boxes. So it's also wider than one what? 5 little boxes equal what? One. Don't throw up game signs, Freddie. It's wider. Go ahead and tell her. It's wider than what? Say it.
It's wider than the box.
It's wider than one big box, right? Because one big box is 5 little boxes. So there's different ways of saying it. That's why I'm trying to get across to you guys. So that don't get confused with. So that way you guys know different ways of saying it. So it don't mean the same thing. Just look at things as symbols. Okay. So one more time. I'm gonna start with you, Freddie. Don't throw up any gang signs. Just tell me. It's going on YouTube. Your parents gonna watch this. All right. I have a first degree heart block. That means what to you?
That it's wider than 0.20 seconds.
Awesome. So you have a first degree heart block. What's a different way of saying that? If you had to tell me, if I think differently, you know the way I think. I think in symbols.
It's wider than 5 boxes.
That's wider than 5 boxes. I have a first degree heart block. Besides saying is wider than 0.20 seconds, it's wider than 5 little boxes. You can also say it's wider than what? One big box. That's it. It all means the same thing though. You guys see that? That's what I'm trying to get across here. Perfect. Okay. All right.